So we are looking at the liver flukes. Now, flukes, before we understand that, worms themselves are classified into the flatworms, also known as platyhelminths, and the nematodes, which are the roundworms. Now, the platyhelminths, you have got the cystals and the trematodes. And then the nematodes, you have got those that are found in the intestine and those that are either found in the tissue or the blood. So the flatworms, the cystals, you have got Tinea solium, Tinea saginata, Diphlobophium latam, Echinococcus granulosus. The trematodes, which are the flukes, you have got the cystosomes, Cystosoma mansoni, Hematobium japonica, intercalatum, and then you have got the fasciola, Fasciola hepatica, Fasciola gingatica, you have got Clonicis sinensis. So today we are talking about the liver flukes. So this is basically the fasciola, guys. Fasciola hepatica and fasciola gigantica. So you can see fasciola hepatica, also known as the sheep liver fluke. This guy will cause obstruction of the biliary tract. Okay, so that is a general understanding. Now the trematodes, where you find these liver flukes, they are leaf-like. That's how they look like, leaf-like, and they have got the head that possesses two suckers, but they don't have hooks. Okay, because the cystodes have got suckers and the hooks. These ones have got two suckers but no hooks. One is the oral sucker for feeding. The other one is the ventral sucker for attachment. They have got an incomplete GIT, meaning that they have got a mouth but no anus, and most of them are hermaphroditic. In other words, they are monoecious. The same worm is male and female, except the cystosomes, where you have got a different male and a different female. Now, when you look at the liver flukes now, liver flukes are just a group of these flukes, the trematodes, okay, which have got male and female in the same worm. And the adult of these liver flukes, the adult worm, will be able to infect human and live in the biliary, intestinal, or respiratory tracts. Please take note: the biliary tract, the intestinal tract, and the respiratory system. Now, just to help you remember some about the biliary tract, of course, something that you already know from your anatomy, here is the liver. Okay, and you know that the liver has got two lobes, the left and the right. So what is going to happen is that on the right you are having what we call the right hepatic duct joining with the left hepatic duct, and this will form the common hepatic duct. This is the common hepatic duct. And then you have got what we call the gallbladder here, which will send its duct, which we call the cystic duct. When the cystic duct join with the common hepatic duct, we are going to form the common bile duct or the bile duct. And this bile duct is further going to go and join with the duct that is coming from the pancreas. From the pancreas, we have got the major pancreatic duct of Huisang. You also have a minor pancreatic duct of Santorin. So when these join, you are going to form what we call the pancreatico hepatopancreatic duct, which is going to drain in the second part of the duodenum. So when it comes to these liver flukes, they're actually going to occupy any region of this tract that we've discussed here. This is what we call the biliary tract, because that's where bile gets to how bile gets to flow from the liver, going to the bile duct and then flowing down. But take note that it can also be found in the intestines and the respiratory system. So the flukes that we call liver flukes here, we have got fasciola hepatica. Okay, that's the liver fluke. Fasciola hepatica. We also have got clonosis sinensis, and also sometimes opis, opisthosis species. But mostly, as we discuss the liver flukes, we talk about the fasciola hepatica and clonosis sinensis. Okay, hope that makes sense. Now, again, when you look at the fissures, okay, this slide I think is a misnomer here. Fasciola hepatica, because for the liver flukes, I've got fasciola hepatica, fasciola gigantica, and then the other one that you've mentioned here, the clonosis sinensis. Fasciola hepatica itself is also known as a sheep liver fluke, and its primary host is a sheep and cattle to a less extent, but mostly the sheep, fasciola hepatica. It is the largest and most common liver fluke which is found in humans. It causes liver rot. This is basically a disease in the sheep because the disease caused by fasciola is known as fasciolosis. In the sheep, that's called fasciolosis in the sheep. That's called the liver rot. Okay. So where does fasciola hepatica stay? It lives in the biliary passage and also in the liver of the definitive host. The definitive host is basically where sexual reproduction is going to be happening. And then the morphology, this guy, because it's a trematode, it's leaf shaped. The color is gray or brown, okay, grayish or brown, and it has got a lifespan of about 5 years in sheep, and in humans it can stay up to 10 years. So I've got a worm up to 10 years. That is the adult worm. And then for the eggs of Fasciola hepatica, they are large, ovoid. They have got what we call the opacula. This is like a surrounding, the like the shell in which they are. That's the opacula. So they are opaculated and they can be stained by bio. So it's bio stained. The egg of Fasciola contains an immature worm, which the worm is the larva. It's immature and we call it the miracidium. Okay, miracidium. So the egg contains the miracidium, which is an immature worm. The eggs are unembryonated when freshly passed. So, like when the eggs have been released, the embryo inside, there's no formed embryo, it's unembryonated when they are freshly passed. So, the eggs are laid in the biliary passage and are shed in feces. So, the eggs of Fasciola hepatica and the Fasciolopsis are similar. So, that's just another strain. So you can see the egg contains unsegmented ovum, okay, surrounded by many yolk cells. So in the egg, you have got these yolk cells, a lot of them. And then you can see the indistinct opacula, like this shell-like structure. So when you look at the life cycle of Fasciola hepatica, it passes its life cycle in one definitive host and two intermediate hosts. So it has got two intermediate hosts. The definitive host can either be a sheep, the goat, a cattle, or man. That's where sexual reproduction is going to be happening. The intermediate host is a snail. Look at the genus because you have got snails, but they have got of different genuses and different worms target snails of different genuses. So it's of the genus Linia, or I don't know how you can say Alamnia and Saxony. So these two genus is where the Fasciola hepatica is going to specifically target. Okay. And then encystment occurs in aquatic plants. So aquatic plants are the second intermediate host. What does encystment mean? So initially the worm, when the egg is released, okay, it contains this stoma larva. The larva is inside the cyst. So when the larva, that kind of small worm, breaks out of the cyst, we call that existment. But when the larva is taken into the larva is now within the cyst, like it is surrounded by this covering. We call that as encystment. So encystment just means larva is in a cyst. Existment, larva is out of the cyst. Okay. So encystment occurs in aquatic plants. So when you have got a plant, the larva is going to be surrounded by this cyst. And the mode of infection for Fasciola hepatica is ingestion of metasecaria insisted on aquatic vegetation. So I've got the metasecaria that is present because the metasecaria is actually a, a small worm, the larva. And this one is in a cyst and it's present on aquatic vegetations. You get those aquatic vegetations, you get to eat. So how is the life cycle of this guy? The life cycle of Fasciola hepatica. So the life cycle starts with the eggs. The eggs contain an immature larva. Okay, just a moment. Yeah, so the eggs contain an immature larva, or that's the embryo. We call it the miracidium. So the eggs are going to be passed in feces, and the unembryonated egg is going to be released. It's unembryonated because you really don't have an embryo, a larva embryo inside. So when these eggs have been passed, remember the eggs contains the immature embryo. It's an embryonated. In fresh water, when these eggs are passed, the eggs are going to embryonate. They are going to hatch, okay, and then they are going to hatch into the miracidia. And this takes about 10 days for the egg to hatch into the miracidia. The miracidia then is going to enter the snail, which is the intermediate host. Take note of the genus Limnia, okay? And then inside the snail, the miracidia is going to convert into sporocyst and into the redi. Now, these redia, you have got the first generation and the second generation. So I'm moving from miracidia, sporocyst. From sporocyst, you have got the second and first and second generation redia. And then you are going to have secaria. Now you are going to form the secaria after like 1 to 2 months, okay, after this process. Now the secaria is now going to move out of the snail, and then it will be surrounded by a cyst, and then it is going to attach itself to aquatic vegetations as metasecaria. So meaning once the secaria insists, you're now going to have a metasecaria, it converts into metasecaria. Metasecaria can survive attached to these aquatic vegetations for long. And humans are going to get this metasecaria, which is the infective form, when you eat the raw water plants. Okay? The larva is going to exist once you eat. Okay, the metasecaria, that is a larva. It is now going to move out of the cyst, that is existment. And that is when the metasecaria has gone into the GIT. It's in the duodenum that it undergoes existment. And once they are in the duodenum, it is going to pierce the wall of the duodenum, and then it to penetrate, pass through the peritoneum, and then it will go to the liver and pass through the capsule of the liver, which we call the Gleason's capsule, and then invade the liver. While they are in the liver, it is going to transverse through the parenchyma or the liver and then reach the biliary passage, and where in the biliary passage they're going to mature into the adult worms in about 3 to 4 months. So at that point, they will start now causing the problems. Okay, so you can see again here, this is the cow that can get to release these eggs in feces, and then the eggs are now they contain these immature larvae. So the larva is going to come out, the miracidium. Miracidium is going to enter the snail, convert into sporocyst. Sporocyst will convert into the radia. The radia will convert now into the secaria. The secaria is now going to undergo encystment and attach to these aquatic plants, forming the metasecaria. The metasecaria can now be taken by either the cow, human, or any other host, and then it is going to start growing in that host, forming the adult worm. Okay, so that is what happens. So the pathogenesis, how does now this cause disease to human? So fasciola hepatica causes zoonotic disease, meaning that it is passed from animals to human, which is the fasciolaisis. That's the disease caused by fasciola. And this one, because remember we said that another liver fluke is a clonosis. So fasciolitis is different from chronochasis in that fasciola hepatica is larger, and so it causes more mechanical damage. But really the infection is more similar because they are both liver flukes of fasciola and the clonosis sinensis. Now in traversing the liver tissue, as the worm just the metasecaria, or the worm is actually passing through the liver tissue, it is going to cause the injury to the parenchyma of the liver, and that will cause inflammation. Some of the larvae will actually penetrate right through the liver and diaphragm, and they will end up going to the lungs. So after ingestion of metasecaria is followed by symptom-less incubation period. Okay, that lasts days to few months. So when you ingest this guy, you barely see symptoms. Okay, but the clinical manifestation. So I've got the three main phases. We've got the asymptomatic phase when there is infection with this fasciola hepatica or the liver fluke. Asymptomatic phase, acute phase, which is known as the invasive phase, and then the chronic phase. The asymptomatic phase, what you are going to be able to see in this phase is there is just some form of fever, right upper quadrant abdominal pain, all right, representing infection of the liver, and also hypereosinophilia. Eosinophils are going to be a lot. In the acute phase, which is the invasive phase, this is during the migration of the larva. So the patient is also going to have fever, upper quadrant, right upper quadrant pain, eosinophilia, and also there's going to be hepatomegaly. The liver is going to become big and it's going to be tender. Like when you're trying to press in the right upper quadrant of the patient, they're going to be feeling pain. Okay, so the symptoms will actually subside as the parasite reach their final destination. And then in the chronic phase, this is now where there's biliary obstruction. There can also be cholangitis, now inflammation of this biliary tract. There's going to be fibrosis. Okay, the liver can become fibrosed, and in some cases it can be carcinogenic, like a cancer can get to happen. Okay, so the parasite in the chronic phase has reached the bile duct. So in the chronic phase, what is really happening is that the parasite has reached the bile duct and stimulates inflammation in the biliary epithelium, and that leads to fibrosis. Okay, because every time there's chronic inflammation, remember a feature of chronic inflammation is that there is fibrosis, there is a formation of a granuloma. So the patient may develop biliary obstruction, biliary cirrhosis, cancer of the biliary tract, obstructive jaundice. Okay, because bilirubin is going to, there's disturbance in bilirubin can't flow, so it will end up accumulating. There can also be cholelithiasis. These are stones in the biliary tract. Okay, and then they can also be anemia. So another thing that you see in chronic phase is that there can be bacterial superinfection that can occur. Because of all these problems that are happening to the liver, bacteria can end up now finding a privilege, because by this time the immune system is busy trying to fight this side. So bacteria has found a privilege, so it can come and get to cause an infection, getting to add up to the problem that's already there. So we there's really no hepatic association with hepatic cancer being described with fasciolosis. In other words, when you have got fasciola hepatica, there's not really any association whether it causes cancer of the liver. Okay, so occasionally ingestion of raw liver of infected sheep will result in a condition that is called the hazon, which is meaning suffocation. So if you get the liver raw of the sheep, you eat it, you can get that if that liver has caught this fasciola, and that disease is hazon. The adult worm in the liver will attach to the parenchyma mucosa, and that is going to cause edematous congestion of the pharynx and the surrounding area. So because of this edema is going to lead, remember it's edema of the pharynx. Pharynx leads to the airway, so that is going to lead to difficulties in breathing. And also because the pharynx is actually, because the pharynx has got different parts. We've got the nasopharynx, we've got the oropharynx, we've got the laryngopharynx, and then down the pharynx, you're going to be going into the esophagus. Okay. Actually, from the pharynx you go to the esophagus because the larynx is in front. That's the air passage. But it's the inflammation of the pharynx, because also connecting to the airway, there can be this difficulty in breathing, dyspnea. But because the pharynx will further lead into the esophagus, if there is this inflammation and there is this congestion, there is this edema, there will be difficult in swallowing. So that's the C phagia. Okay, it can also lead to deafness. Actually, the pharynx is connected to the ears. Okay, there is a tube, the eustachian tube. So it connects these two structures. So they can be deafness, and rarely they can be asphyxia. Okay. These difficulties in breathing, especially as asphyxia happens in children, is there's so much difficulty in breathing, such that carbon dioxide is ending up accumulating and accumulating. So the complications of fasciola. So basically the liver flukes. For fasciola, you have got what we call the pipe stem liver. So this is where I've got an abscess-like lesion, which looks like a tumor. But not really, it just mimics a tumor. And then for clonosis and the opistosis, opistosis. So these ones, they have got a strong link to bile duct cancer. They can cause cancer of the bile duct. Remember, we said that fasciola is really not linked to cancer. Okay. So fasciola gigantica is also, so we have talked about fasciola hepatica. Now fasciola gigantica, this one is known as a giant liver fluke. Remember fasciola hepatica was a sheep liver fluke. Fasciola gigantica is gigantica just means giant. Sometimes you see common liver fluke, common liver fluke. Okay, it's a parasite of herbivores. Okay, although human cases have also been reported. So the life cycle, pathogenesis, and clinical features are similar to those of Fasciola hepatica, but the intermediate hosts are different snails. So it is basically the snail is the same, but it's a snail of a different genus. Okay. Fasciola gingatica is larger than Fasciola hepatica and lives in the biliary passage of its host. Its egg is hard to make difference from Fasciola hepatica and Fasciola Bosky. So they have got a worldwide distribution, especially in livestock. They are of economic importance. Okay. So how do you diagnose infection by fasciola? You can do parasitological diagnosis. You get a stool, and in the stool, you basically want to look on the microscope to detect these eggs that have got an opercular, okay, operculated eggs. And then you can also get an aspirate from the duodenum or the bio, okay, bio sampling, and there you can still see eggs. Okay, in cases if there is obstruction, you can see eggs. Please take note of what you see for these samples. And then you can also do a corporal antigen ELISA. So for the ELISA, is basically ELISA is there to detect the antigen of the parasite in the feces. And this one is important in early infection, because early in infection you will not see the worms. Okay, so before you can see the worms, you can actually detect just the antigen, and this is used most in chronic fascioliasis. You can also do some blood tests like the antibody detection is using ELISA, and also western blot to confirm species, the specific exposure. Imaging also, like imaging, you can do an ultrasound which can show a dilatation of the bile duct, okay, and also liver lesions. You can do a CT scan or MRI to detect any abscess, fibrosis, or cholangiocarcinoma, any cancer of this biliary tract in chronic cases. There's also the endoscopic retrograde cholangiopancreatography. Okay, so you can see what you are seeing. Cholangio, that's the biliary tract. Pancreato, because you're also looking at the pancreatic duct. Okay, pancreas. So cholangiopancreatography. So this is abbreviated as ERCP. So here you are directly visualizing the adult worm which is in the biliary tract. Remember, the biliary tract just doesn't contain the hepatic guy, you also have the pancreatic duct. Hematological clues you are going to see eosinophilia. So when you look at a peripheral blood smear, and then you are looking at, you are seeing a lot of eosinophils. Normally eosinophils are going to be elevated in uh, helminthic infections. Also because there's injury to the liver, so you see elevated liver enzymes, ALT, AST, ALP. And then histopathology, you can also do a liver biopsy which can reveal a granuloma, eosinophil infiltrating, or the fragments of the tissue. Now the treatment of fasciola hepatica, fasciola gigantica, or basically the liver flukes, you can give antiparasitic therapy. So the drug of choice for fasciola is the triclabendazole. Okay, you will not see it a lot. It is just on fasciola because most of the worms, the drugs that you see is praziquantel. But here, the first line for fasciola is the triclabendazole. Okay, and it's effective against both the immature worm and the adult worm. Another drug that you can give is bithianol. Praziquantel is useful for clonosis sinensis, opstosis also. But praziquantel, even if it is effective against most of the worms, please, it is not effective against fasciola, hepatica, or gigantica. This is so strange because it's actually the drug of choice for most of the trematodes, but it is not a drug of choice for fasciola hepatica. So in patients where there is obstruction, you can actually do a manual extraction of the adult flukes. So via endoscopic retrograde cholangiopancreatography. So you're trying to visualize at the same time you can be pulling those guys away, the worms. Okay. So just go through maybe on YouTube or something, just search any procedure to remove worms. You'll see how many worms come out. These guys can be a lot. So you can also do some supportive therapy. You can give a corticosteroid like prednisolone, okay, especially where there is severe eosinophilia. So this is basically to help in inflammation because corticosteroids are anti-inflammatory drugs like prednisolone. If there is pain, remember we said there's going to be right upper quadrant pain, so you can also give drugs to help with the pain, okay. And we said also there might be fever, so we can give drugs to help with the fever. So analgesics and antipyretics. You can do a surgical intervention, and it's rare if there are complications like obstruction of the biliary tract, cholangitis, inflammation of this biliary tract. So how can you prevent fasciitis? Okay, inspecting the plants, especially watercrease for metasecaria, or not eating plants grown in areas where herbivore animals are found, where you have got these cattle, these sheep, okay? So not eating plants grown in those areas. Also preventing contamination of water with feces from infected animals or people in areas where aquatic plants are used for food. So also cook water, grown vegetables thoroughly before eating. So you cook properly. So water grown vegetables should be washed with 6% vinegar or potassium permanganate. So please take note, you can wash them. If you want to wash these water grown vegetables, like okay, these vegetables that are grown like growing in the water, before you eat them, wash them with vinegar and potassium permanganate, not with water, for 5 to 10 minutes. Okay, not just 1 second. You want to make sure that you kill the insisted metasecaria. Okay. So avoid sewage contamination of growing areas and the use of molluscides. So the molluscides, these kill mollusks. Mollusks include snails, slugs. So these drugs will basically get to kill these things. Okay, and is the most frequent public health intervention. It prevents the transmission of many other trematodes, like cystosoma, because the snails are basically the transmitters for most of the trematodes. Also educate people, give them health education, educate them about just hygiene, the need for them to cook the water, the importance, why are they doing that, because if someone doesn't understand why they're doing something, they might end up not even doing it at all. Okay, so some questions. The life cycle of liver fluke requires an intermediate host. What is this intermediate host? So remember the intermediate host for the liver flukes, you have got two. The first intermediate host is the freshwater snails. Second intermediate host are those plants really. Infection in human with liver flukes is primarily acquired through the ingestion of undercooked meat, edible aquatic vegetables and plants, or undercooked freshwater fish, contaminated drinking water from the river, close contact with infected animals. So infection is via edible aquatic vegetables. You go and eat those vegetables from the water and then you get the metasecaria. While often asymptomatic, chronic liver fluke infection in human can be associated with signs such as fever and chills. Now, fever and chills, that is not really chronic, that is acute, right? Jaundice and abdominal pain, that's chronic, isn't it? Itching and diarrhea and renal. So we had mentioned the three phases. We've got the symptomatic, you have got the acute, and then the chronic. Which of the following is not a method to control or prevent liver fluke infection? Not a method. Strategy use of fluke drenches, antihelminths. Yes, you can give antihelminths, drugs that will help in clearing out the worms from the body. And then fencing off fluky areas to prevent livestock access. So those areas that you think, okay, these are not too good, you get to fence them off so that animals don't go there, because once animals go there, they're going to end up getting these worms. Ensuring all snails in a region are eliminated. So this one is not a method to control. You can't really eliminate all the snails in the region. You can't. But of course, this is something that you want to do. That's why we're giving those drugs to help clear some snails. But you will not really ensure that all of them are eliminated. Monitoring fluke status through fecal sample or blood test. Okay, so you can as well monitor. What is the most common liver fluke species that infect cats? Fasciola hepatica is the most common liver fluke infecting cats, sheep, cattle, human. Liver fluke are a type of parasitic worm that belongs to which class? Remember, the flukes are trematodes, right? Which of the following is a common symptom of chronic liver fluke infection in cattle? Okay, so in cattle, you basically see weight loss and reduced production. They can't have more offspring. The similarity between Fasciola hepatica and Fasciola gigantica is that both are flatworms. These are not flatworms, isn't it? Okay, the flatworm, these are platyhelminths. Actually, these are flatworms because the platyhelminths, that's where we find the cystos and the trematodes. And the trematodes are an example. Both are trematodes, yes. So the answer is both A and B. Okay. Fasciola hepatica is also called. So we said Fasciola hepatica is sheep liver fluke, and these questions are from last year's test too. Fasciola gigantica is also called. So the gigantica is a common liver fluke or the giant liver fluke. The correct order of developmental stages of Fasciola species in the snail is, remember, first you have got the Miracidia. The Miracidia is going to enter the snail and then convert to sporocyst and then redini and then secaria, right? What is a potential long-term complication of chronic liver fluke infection in human, as seen in some cases in Vietnam veterans? So, potential long-term complication: gallstones, pancreatitis inflammation, cholangiocarcinoma. So, there can be cholangiocarcinoma, the cancer of the biliary tract, especially remember, not really with the, especially not with the fasciola, but clonosis. Okay, that's the one which is more associated with the cancer. How are humans typically infected with liver flukes? By consuming undercooked animal liver? Really not. We said, of course, you can get if you eat the liver of sheep, but that one has got another term, isn't it? So that's not the main mechanism, but of course, you can get the infection by eating that. By ingestion of contaminated water from streams, true, right? Because the contaminated water might contain this metasecaria. By consuming edible aquatic vegetables, that's also true, right? So it's all of the above. Which diagnostic method can be used to identify liver fluke eggs in stool sample, although intermittent shading may require multiple samples? So which diagnostic method is used to identify liver fluke eggs in stool sample? So what you do is the stool examination, ova and parasite. You'll be trying to look for the ova, which is basically the small ones like the eggs, and then the parasite in the stool. Which of the following is the primary intermediate host for liver flukes? It's the snails, isn't it? You also have another intermediate host, which is the aquatic plants. Microscopy is very important for diagnosis in parasitology. Which of the following are true of the eggs of Fasciola hepatica? Remember we talked about the eggs. They are filled with yolk cells. That's true. Yellowish to light brown. We also talked about the color, isn't it? That's true. Contain a mature miracidium. Now they contain a miracidium, but it is immature. Remember? Okay. Operculum seemingly resting on shoulders. Oh, yeah, that's not true. But they have got an operculum. Although both fasciole hepatic and the clonosis sinensis are liver flukes, their respective life cycles differ. So the adult of Fasciola hepatica largely reside in the small or medium biliary duct. The adult of Clonosis sinensis largely reside in the large biliary tract. For both the miracidium penetrate a suitable cyclopropagative intermediate host. Clonosis sinensis requires two intermediate hosts. For Fasciola hepatica, the infective stage is insisted miracidium on water plants. So we want really their respective life cycles differ. So what is the difference between them? The other options that we can see are really correct, but for C, for both, the miracidium penetrates a suitable cyclopropagative intermediate host. And then D, clonosis sinensis requires two intermediate hosts. So they, of course, you know the intermediate hosts. You have got the snail, then you have got these plants. Okay. The following among the infective prevention and control measures the community can apply against the fasciolosis, busk or infection. Treatment of all patients with plasquanta, avoidance of feeding water plants to pigs. You want to prevent this because that water plants will end up infecting these guys. Elimination of snail population. Yeah, you want to eliminate the snails. That's why you give those drugs to eliminate them. Eating only thoroughly cooked freshwater fish. Okay, only eating only thoroughly cooked freshwater fish. Of course, you want to make sure that you cook them properly. Okay. Avoidance of open swimming by adults. Now, you don't really get these worms by swimming. Okay. So D is not really wrong. Eating only thoroughly cooked freshwater fish because we said that you can get now most of the infection, of course, you can get it from the water if you eat the fish or because the fish can end up eating the plants. But normally you are getting the infection from the plants. Okay, so that's why we're trying to avoid things that has to do with anything to do with eating the plants. But also the animals, you want to make sure that they are well cooked as you eat. So this is really not wrong there. It's also a correct statement.